Hello, my name is Sharon Mbugua. I'm a daughter, I'm a sister, I'm an aunt, and I also live positively with epilepsy. My journey began in December of 2012 when I had my very first seizure. 1 minute I was with a friend, and the next I woke up in a dark room, which I then realized later was a clinic. And I woke up to my aunt and cousin having been called by the doctor because my then parents were out of Nairobi. My cousin then took me to what I felt was the nearest hospital at the time, which is the Karen Hospital. I went there. I was admitted. I had several tests. And I was discharged. I had been wrongly diagnosed with a cardiological condition. And so I then went to see a cardiologist, after which I proceeded to have several visits to a neurologist, by then with my mother who had traveled to Nairobi. And unfortunately, we were not able to have a diagnosis here. And so we opted to travel with a family member to India, where I was diagnosed. I was treated. I was discharged. I later went back for a medical review, which showed that everything was well, and I was a very thankful person. 3 years later, I had another one. And this time, I, of course, was in touch with the team from India and trying to understand what had happened. I was put back on anti-seizure medication. But between then and mid this year, I have averaged about 3 seizures each year. And the frustrating thing was that each time I had one and I had an MRI done, it would show that I'm normal. Yet I could obviously see that there was a problem. And in conversation with a family doctor, she suggested that I speak to a neurologist, which I did, and he diagnosed me with epilepsy. Now, epilepsy is just the medical term given for multiple unexplained seizures. And technically what happens is that there's a crossfire of neurons in the brain, and that then causes the mind and the body to shut down temporarily and typically black out until one comes to. And so I actually say that diagnosis was my blessing, because I was finally able to put a name to what I was going through, and then began the journey for me to try and source more information about it. I read up on possible support groups online. And the last time I had what I would call a collapsive seizure, where I fall and I black out, was in March of last year. I was alone in my bathroom and I fell. And eventually I was able to come to, at which point I reached out to a doctor friend of mine who directed me to a counselor at Aga Khan Hospital, who then directed me to a doctor who I got to learn is the chairman of an NGO that actually supports people living with epilepsy. And so I went there, and of course I began by saying what a challenge it had been to find out about them. But being an NGO, the program manager was able to explain that with resource challenges, they were not able to create as much online and media awareness. So I then joined this NGO, whose name is the Kenya Association of the Welfare of People Living with Epilepsy, which is a mouthful, but you abbreviate it as KAWE. So what I did is join their database. They already had quite a big database, which then meant that I received information as it was available, and I was included on their WhatsApp group, a support group, which is really useful for several of us who live with epilepsy. We're able to share our challenges, which often have to do with the kind of medication we're taking, our reactions to them, the affordability and access to medication, the fact that some people who are still on medication still have seizures, and there are different kinds of seizures. And so all these we discuss, we share success stories. If some of us who have had a seizure-free day or week, and that's something we're excited about. All these are things that we share and exchange on the chat group. Now, KAWE have a really, really great model where they want to show the county government, given that the element of health has been devolved. What they have done is set up office containers at grounds where there are MOH county offices. So, for instance, in Karen, at the MOH county offices, a container office exists, which is partitioned into 3, and there's a waiting area for people living with epilepsy, and people are seen by a clinical officer and eventually given medication, which is subsidized for as low as 30 shillings. And so they have gone a great way to be able to prove or to begin proving about affordable models of healthcare. And they do have these pilot clinics in Karen, in Ruruta, and in Huruma. So coming back to my story and how I've been affected, as well as what I'm doing to self-care. I've been affected by not having the ability to drive right now, to self-drive, which has of course affected my independence. I can no longer hop into a car without thinking and take a drive to somewhere new. I've had to share a driver resource with my parents who, given that I'm single, are my next of kin and who have really walked this journey with me, and they've really supported me. And so that is what happens. I have to be watchful of what I eat and try and eat healthy as much as I can. It's not always possible, but I do try. I have to sleep regularly, and I need to stay away from extended periods of exposure to light, computer and television light, not stay hungry, and avoid stress, because these, by elimination, I've determined are my triggers, which then means that I'm unable to work in a typical office environment, which does portend some levels of stress, and actually was one of the reasons that I ended up leaving my almost last permanent place of employment, since I wasn't sure if it was the environment that had actually led to this seizure. And so I now run a business, a consultancy business that focuses in market and social research as well as talent assessment. It has had its ups and downs, as any consultancy would, and I've had many periods of irregular income. But I am controlled now, so that as long as I'm taking my medication and taking care of myself, I'm able to take on fairly stress-free work, which I'm keen to do, and I'm actually on the lookout so that I'm able to supplement the income from my business. The other things I do for self-care are to ensure that I take my medication all the time and on time. There've actually been periods or a couple of occasions where I've had a seizure because I've forgotten to take my medication. And so it's important to calendarize the day, the time of having your medication taken, and to take it on time, because again, any irregularities from the schedule, the required schedule of medication, again exposes you to the risk of seizures. So where am I going forward? I consider myself living positively with epilepsy. I don't let it define me. It has affected me, but it is not everything about me. And indeed, that is the story of so many of us who live with mental health conditions, where it is only a part of us. And we've had many, many great people do very great things who have lived and battled with various mental health challenges. And so I'm now a part of a mental health advocacy group who came together in January, and actually through our efforts were able to push for representation for users and caregivers on the Mental Health Task Force, whose findings have been recently released. And so that was a win for us. And we continue to advocate. We continue to advocate for affordable medication, which we are pushing to have very lightly taxed. We continue to push for accessible medication. We continue to push for more outlets to access NHIF service, and a number of initiatives more. We've continued to seek audience with various levels of government, especially now in the COVID season. We need to take extra care of those among us who are living with mental health conditions. And so ours is not a fight. Ours is a united effort to seek equal services and to be fully integrated with the rest of our society. And for myself, I choose to live victoriously. I choose to be thankful. And this is my message of encouragement to all of you